What is drugs? Drugs are substances that change a person's mental or physical state. They can affect the way your brain works, how you feel and behave, your understanding and your senses. This makes them unpredictable and dangerous, especially for young people. The effect of drugs is different for each person and drug. What is considered drug abuse? Drug abuse, as a recognized medical brain disorders, refers to the abuse of illicit substances such as marijuana, heroin, cocaine or methamphetamine, or abuse of legal substances such as alcohol, nicotine, or prescription drugs. Why does addiction most often develop during adolescence? But the reason for abuse may be different, as teens often abuse a substance based on its accessibility. Teens are also more likely to take excessive amounts of drugs and alcohol because of how they perceive the risks and dangers. What are the common reasons why substance abuse occurs in adolescence? Common reasons teens abuse drugs include curiosity, peer pressure, stress, emotional struggles, a desire to escape. What is illicit trafficking? Generally, drug trafficking means production, distribution and sale of illegal drugs. Historically, it is possible to talk about appearance of illegal drug trade around the beginning of the 19th century. What are the consequences of drug trafficking? The penalties for drug trafficking are usually a jail or prison sentence, fines and supervised release. Many factors play a role in how a drug trafficker is sentenced. These factors include the type of drug, the quantity of drugs and the distribution area.
So, let's take a look on the effects of drug abuse. Drug misuse, abuse, and addiction can all lead to both short term and long term health effects. The short term effects include changes in appetite, insomnia or sleeplessness, increased heart rate, slurred speech, and so on. The long term effects include depression, anxiety, panic disorders, etc. Other effects like kidney damage, respiratory problems, overdose, cardiovascular disease are also common. In addition to these health effects, relationship problems, behavioral changes, changes in appearance, poor potential, etc. are striking impacts. So, let's stop and fight against the abuse, misuse.
We are celebrating International Day Against Drug Abuse. Here, I want to say about which are the treatment for drug abuse. First, the major treatment modalities methadone maintenance, therapeutic communities, outpatient drug-free programs, and some criminal justice system. Based treatments such as civil commitment have all been shown to be successfully by most outcome criteria program. The result of the treatment evaluation research based on the drug abuse reporting program are summarized and discussed. The drug abuse reporting system containing almost 44,000 admissions during 1969 to 1973 to 52 treatment programs located throughout. Behavioral therapy is perhaps the most commonly utilized types of treatment for addiction that is frequently used during substance rehabilitation. The general behavioral therapeutic approach has been adapted into a variety of effective techniques. Effective treatment attends to multiple needs of the individual, not just his or her drug abuse. To be effective, treatment must address the individual's drug abuse and any associated medical, psychological, social, vocational, and legal problems. Counseling and other behavioral therapies are the most commonly used forms of treatment. Medications are often an important part of treatment, especially when combined with behavioral therapies. Treatment plans must be reviewed often and modified to fit the patient's changing needs.
മയക്കുമരുന്ന്, മദ്യം, പുകയില തുടങ്ങിയ ലഹരി പദാർത്ഥങ്ങൾ വ്യക്തികളെയും കുടുംബങ്ങളെയും ആരോഗ്യപരമായും സാമ്പത്തികമായും സാമൂഹികമായും സാംസ്കാരികമായും നശിപ്പിക്കുന്ന സാമൂഹിക വിപത്താണെന്ന് ഞാൻ മനസ്സിലാക്കുന്നു. ഞാൻ ഏതെങ്കിലും ലഹരി പദാർത്ഥങ്ങൾ ഉപയോഗിക്കുകയോ അത് ഉപയോഗിക്കുവാൻ മറ്റുള്ളവരെ പ്രേരിപ്പിക്കുകയോ ചെയ്യുകയില്ലെന്നും ലഹരി വിരുദ്ധ പ്രവർത്തനങ്ങളിൽ പങ്കെടുത്ത് എൻ്റേതായ കടമ നിറവേറ്റുമെന്നും ലഹരി വിരുദ്ധ സമൂഹത്തിനായി പ്രയത്നിക്കുമെന്നും ഞാൻ പ്രതിജ്ഞ ചെയ്യുന്നു.